Hello, everyone. Thank you all for tuning in. So, my name is Manan Shah, and I'm a child psychiatrist. I practice in Maryland. I also serve as the president of the Maryland chapter of the IAPA, which is the Indo American Psychiatric Association. So, joining me today are my friends and colleagues, Dr. Rachna Raisinghani, Dr. Sunil Krishlani, and our expert guest, Dr. Ranga Ram. So I'll just go over brief introductions for everyone. Sunil is a general and addiction psychiatrist, and he practices in Maryland for the last several years. Um, Rachna is a general and consultation liaison psychiatrist, which means she treats people with mental health issues with
Are you able
complex.
to see it on your phone? Are you able to see it on your phone, or are you able to see it because it still says it's not? It'll start soon.
Mine has started for sure because I can see the.
I think it started because I can see the live video.
Okay.
Okay,
For
yeah.
sure because I can see the.
It's there.
Okay, all right.
We're good.
Yeah, sorry about that. Um, so, um, so yeah, I was saying that Rachna is a general and consultation liaison psychiatrist. So Sunil, Rachna, and me have been having conversations for a while about how there are several unique challenges in South Asians, particularly when it comes to mental health, based on our backgrounds and our observations. Um, Even more so because of some current events going on in the world and in India, more people are talking about these issues. So Sunil had this wonderful idea about just taking these conversations public and just talking about all of these issues more openly because we really want to try and mitigate the stigma. We really want to get more people talking. We want to share the information that we have and hopefully keep these conversations going and hopefully create more awareness. So today we're starting a new Facebook Live series to have conversations about mental health in South Asians. And today's our first session. We're hoping to bring to you more conversations about different related topics. Today we want to focus on suicide. Um, so we have with us our expert guest, Dr. Ranga Ram. So Ranga, you've been a great friend and a mentor for me for the last several years. Dr. Ram has trained in India as a psychiatrist with the late Professor Dr. Venkoba Rao, who was actually one of the first psychiatrists to study suicide in detail. Dr. Ram has a fellowship in psychiatric epidemiology from Johns Hopkins, and he's a board certified general and addiction psychiatrist. He currently practices in Delaware and he specializes in TMS, which stands for transcranial magnetic stimulation, which is a new form of treatment of depression. And he's very well published. He has more than 25 peer reviewed articles and two book chapters. So we're really grateful that you're here with us. Thank you so much.
Thank you for having me.
Yes, yes. Rachna, do you want to start by presenting a little bit about suicide?
Sure. So it's great to be here with all of you, and I hope that this is just the beginning of many, many engaging conversations on various aspects of mental health. I want to thank all my co panelists over here, but I also want to say thanks to someone who is not on your screens. That is Sharmila Karamchandani. She's Sunil's sister, and she's someone who has been with us from the inception of this project and has helped us with the marketing, the graphics, the setting up of the page, etc., and also with her contributions to talking points, etc. So, Sharmila, a big shout out to you and thank you. And as a disclaimer, I will say, we are obviously going to talk about some very serious things, but uh, you know, a common thread to all of us is Hindi cinema or Bollywood. So I would not be surprised if a lot of references to Bollywood pop up during our conversations. I think in general, cinema is reflective of our values and beliefs, and that is what we see on the screen. It also gives us some sort of framework or context to understand the things that we are talking about, and also it can bring some sort of levity and lightheartedness to conversations that can sometimes become very intense. So with that, um, I would I would want to talk a little bit about suicide, and then I'll hand it over to Sunil and Ranga to expound more on it. So Geet from Jab We said, "मैं अपनी favorite हूँ," and that tells me that I think that humorous statement tells me something very profound, that we are all hardwired to love ourselves. Self-preservation is a very, very important thing from a point of view of biology for propagation of the species. So we are all hardwired to survive and propagate. So then, what really happens that someone, you know, does something or feels something that leads them to this final common step of actually taking their own life is a very, very complex phenomenon. And I think these conversations are an attempt to try and understand it better, to see what we can do about it, and are there things we can do to maybe prevent it. So talking about suicide, the term suicide comes from the word suicidium, which is a Latin term for taking one's own life or endangering one's own self. And suicide is as old as humanity. For Indians, there are references to suicide in our mythological texts as Ramayana and Mahabharata. In Indian culture, self-immolation of women when they become widowed in the form of sati, or taking one's own life to prevent humiliation, like in Johar, or or as a form of protest, as we've seen in Tibetan monks when they've or Vietnamese monks when they have done self-immolation or farmer suicide. These are all common examples of situations where people feel like life has left them with no other alternative to take their own life. Then there is another more insidious type, where it is because of an individual's own psychological stressors or their perception of the situation of the world around them, which makes them feel like they have no other choice but to take their lives. Sometimes suicide is used as a bargaining chip. Who can forget Dharmendra from Sholay on top of the water tank saying, if you don't marry me, I'll commit suicide or suicide. And sometimes people may try to do this as a way of getting what they want, but unintentionally, if they do it often enough, the odds run in the favor of then dying by suicide when it's just an attempt. So some of different ways of looking at suicide are they, is it a premeditated suicide attempt, or is it something done in the heat of the moment or impulsively? And approaches to treatment or vary with the kind of attempt it was, or how people have thought about it. Another way of looking at suicide is this a psychological suicide or a social suicide? Um, just to drive home the gravity of the situation or the magnitude of the problem, worldwide, for almost 3 or 4 decades, for as long as we've had more consistent statistics and reporting, there have been close to 800,000 suicides in the world. And India carries the burden of almost 40% of those suicides. In a single year, we lose more people to suicide than we do to a combination of things like HIV infection or maternal death due to childbirth, etc. Yet we see that conversations about it or resources allocated to the prevention or mitigation of suicide are far less compared to any other medical conditions. Um, so another thing I would want to talk about is the causes of suicide, and why this becomes so complex a conversation. And I would like to weave in two different concepts together. One is stigma, and two is the different causes of it. So, for example, if one of us has known someone who had a heart attack, people proudly proclaim that I had a heart attack and I have 2 stents put in, or I had so and so surgeon perform surgery on me, and society then validates their sick role and allows them to say take time off or take rest, or, you don't climb the stairs or you don't go fetch a glass of water, we'll do it for you. And there is that care afforded to people who do that. Or for example, if someone had a fracture, a young person broke their bone and had a fracture, we have friends writing on their cast. So these are very tangible ways of acknowledging someone's suffering and telling them that, we are here for you, we care for you. But the same doesn't happen in the context of mental health issues or leading up to suicide. So, until someone is at that very last stage or has in fact unfortunately completed uh, suicide, we only understand in retrospect the severity of their suffering. So this is an attempt to try and intervene much before things get to that point. Psychiatric disorders often are said to have a biological, psychological, and social component. The biological aspect of it, doctors or psychiatrists can take care of in their office by giving people medications or supplements or trying to understand if there are other medical conditions leading to psychological distress. The psychological aspect can also be similarly addressed by way of psychotherapy or talk therapy. What about the social component? I think so. Conversations like this that we are initiating, this is a form of social intervention to treat depression or to treat other ailments that lead up to suicide. And I think with this introduction, with this in mind, I would like to hand off to Dr. Khushlani, and I'm curious to hear what he and Dr. Rangaram will talk about. And please feel free to send in your questions or comments so that we can subsequently incorporate them in our conversations.
So before I ask Ranga some questions, I just would like to add one point to what Rachna was saying, is that prevention can exist at three levels. It can exist at a universal level where you're basically trying to address the entire population and not in any particular select high-risk group. There are selective interventions that are targeted at high-risk groups, like it might be farmers or it might be teenagers who are preparing for the 12th standard exam. And then there are indicated interventions which are aimed at individuals who've established a suicide attempt or a suicide gesture in their past. So you can kind of narrow your and become more targeted in your interventions to prevent this going forward. So just with that backdrop, I'm going to start a conversation with Ranga. Ranga, yes. A lot of people express things like, I wish I could die, or something similar to that. As a loved one, how do you think people should respond to that? Or second question would be, how do you assess that as a professional?
So if I may, I'll just take the liberty of answering the second part in a way that would set up my answer for the first part. So when you think about suicide, we think of a spectrum of behaviors. It can start with a completed suicide, which is pretty much everybody knows what that means. There could be a suicide attempt. There could be a suicide gesture, and that was the one she Rachna referred to when she referred to Sholay and Dharmendra in that. There can be suicidal thoughts, and then there can be a passive death wish. Why am I here? I wish I could die. Maybe at one end of the spectrum, and it is often expressed by people who could go on to do other things. And that should be the first thing to remember, that a passive statement like that, I wish I were dead, can go on to be a much more serious event. Having said that, how do we talk to somebody, a loved one, who says that to you? The first thing is to recognize that is a statement of giving up. That's essentially at the core of it. Anybody hearing it from a loved one is likely to react with intense emotion because it's such a shocking thing to hear someone say. And the first thing that we would advise anybody who ever hears it from a family member is try to deal with their own shock and emotions inside themselves and try to talk to the person who is expressing it in an empathic, non-judgmental, curious way. One way to say it would be, oh, how did that kind of thinking happen? I'm not going to say that in exact same words, but you have to get that impression there. Anything that is condemning the very fact that they confided in you is going to be counterproductive, and that should be avoided at all costs. You cannot say things like that. It's against God or anything. It's only God who will take you away. You have no way to do it. It's examples of how you should not do it. So my primary thrust here is to tell people, try to put your own feelings aside and try to get an understanding in an empathic way of why they may have said something that is so painful. And at the core of it, it is giving up. And so your questions can be directed to what makes you give up. And one of the things you can remind them is their strengths in the past and say, you've always been the strong person. You've been the rock in my life. And to hear this from you, I want to know why you have come to that kind of a thinking, that kind of a conclusion, something along those lines.
So one thing that is cultural in our context is the use of either guilt or shame to teach. And, it has been seen in parent-child interactions. It has been seen in teacher-student interactions. It has been seen even between friends. And I think one of the things that keeps people from having a conversation, or one of the things that keeps people from reaching out, is the sense of shame. Like, we are taught in therapy that anytime somebody looks down, looks away, doesn't want to talk to you, hesitates to say something, you please consider shame as an operative emotion. So I think we need to be careful about how to, reduce the burden of shame introduced or interjected in our conversations. I think that might be, a simple thing to. And the difference, if many people don't kind of mix the two, the guilt and the shame. Guilt is something, it's an emotion you feel when you feel you've done something wrong. Shame is an emotion that you feel when you feel you're defective as a person. And I think those are two distinct emotions, and people sometimes confuse the two. So, you've already given us some examples of how to non-judgmentally start or have these conversations. In this country, we've been having so many conversations about mental health, so many conversations about suicide, but the numbers are still going up. What do you think are the operative reasons for the numbers going up, maybe in the immigrant population and maybe in the US native US population? What do you think are some of the factors that are causing this statistic to just keep rising?
Well, we live in difficult times. The distress levels among individuals is definitely going up. There is not much of a disagreement about it. This has been a pattern even before COVID. The demoralization and giving up as a societal phenomena has been well connected to the rising opiate epidemic, for instance. That has definitely contributed to not just overdose deaths, but also suicidal ideas and suicidal behavior culminating in death. So there have been these issues. If you talk to somebody who is religious, and this is an area that has always interested me, a religious person would say that there is a rising trend towards agnostic behavior, both here and in India. And that may be one of the contributing factors. And I think that is something to be borne in mind, because I'm always reminded of one of the early studies that Dr. Venkavarao, my professor, had published, was about the differential rates of suicide among Hindus and Christians. And one of the things that he emphasized in that paper was that the thought about suicide being a sin against God is much more emphasized in the Christian tradition, so much so that they couldn't even bury the person in the church's cemetery. I mean, that is sort of a very big piece of what he thought was one of the early differences in the way people think about life, living, dying, and God. So that's one of the things that I would point out.
I mean, I think, when you read about protective factors, religion, spirituality always comes up as a protective factor. So does, children, children, having pets, having connections to the society. But a friend just wrote to me this morning. He said he finds some of the religious discourses or some of the religious um, depictions of this idea, it somehow enhances the need for people to engage themselves with religion, but it devalues or de-emphasizes the role of mental health. And I think that's why I feel it's like a double-edged sword. Before I go on recommending to people that yes, go listen to your spiritual, seek, masters or teachers, I always feel ambivalent, because as much as I know that this is an important protective factor, I also feel that sometimes they get misled, or sometimes their spiritual leaders or their religious leaders take over the mantle of knowing everything or knowing all the answers, and somehow de-emphasize the importance of paying attention to mental health. And so that's why I feel a little ambivalent. And maybe there are different opinions about this, but I always feel ambivalent because of that.
Yeah, I agree with you, Sunil. I think basically it's really important to seek solace in religion and spirituality, but at the same time, one should realize that you need to think about these things critically, and you should also pay attention to facts and the leaders in the field who are trying to talk to you about the real problems. So essentially, you can get support from your spiritual sources, but also to keep your mind open and to not get too carried away. Because there are these cases we hear of people stopping their medications or people getting out of treatment because of this.
Yeah, and I think going back to Rachna's analogy, if somebody's having a heart attack or somebody's having a severe diabetic complication, we don't always go to our spiritual leaders and ask them how to regulate our insulin dosages or how to regulate what cholesterol
Right.
medicines to take or how much nitroglycerin to take. But somehow for mental health conditions, everybody has advice. Like, one of the things I read on WhatsApp after the COVID crisis was like, after the COVID crisis started, we had like almost 1 million COVID experts on WhatsApp. And after Sushant Singh Rajput's suicide, now we have 1 million psychiatric experts on WhatsApp. So
Yeah.
I think people also need to figure out, when they see information, when they read information, what is the credibility of that source? What is the credibility of that person? What kind of life experience do they have, or professional experience do they have to even address such a problem? And I think there's a tendency to take something, if you're an expert in one field, suddenly you start becoming an expert in all the fields, and people start giving advice about things that they have no business giving advice about. I think that's, sometimes I have a problem with that, especially with people who are very big media personalities. So
What I would say to that, Sunil, was that I'd say when people start having these conversations about things that happen, like a public health crisis like COVID or suicide, I think this is people acknowledging that there is a huge social component to that illness. It's just that the conversations are not channeled in the right way. I think there is that uh, poorly articulated acknowledgement of that fact. I think what we can do uh, through fora like these is maybe channel it in the right direction. So
Yeah, that's a very good point. So related to what we're just talking about, we do have a question from Subodh. Sorry. So Subodh asks, do you think the psychiatric profession tends to ignore social factors contributing to suicide, and do mental health professionals have a lobbying or political role? So I'm guessing he's looking at asking both about the positive aspects and also the negative aspects.
So I take a stab at this question. It's an excellent question
Yeah.
from me. I have believed that one of the things that we in the profession, let me connect it to what we were talking about just to make it easy, but that's not the
Yeah.
only place. Psychiatrists have a role to educate, for instance, pastors in churches This has been done very effectively in the United States. I will go back to my early days of practice. I come from a very traditional family that was connected to the temple in my native place. And I would get referrals from the temple priests. So what I'm trying to say is that the social role and the professional clinical role have to be interactive for this to work. It can be at the workplace, it can be in schools. You begin to see examples of how we as mental health professionals have to make that effort to outreach to all these places where people are much more likely to see the emergence of suicidal thoughts and help them understand how to approach it, at least to the minimal effect of appropriate referral. That should be the minimal effect that they should have, but they can learn more as much as they are interested in. That is one way to bridge the gap between the social and the clinical.
Ranga, what is your thought about why have we historically, or why even maybe currently, we don't have as many conversations about suicide in India as we should?
Well, there is a...
Or other South Asian countries too. I'm more familiar with India, but maybe even in other South Asian countries as well.
I think stigma plays a very large role. People rarely ever talk about a suicide in their family. It is extremely hard for people to acknowledge that just because they think it is acknowledging that someone failed or they failed them. See, there's a lot of survivor guilt associated with a suicide in the family. And that also plays a role. And you earlier alluded to shame and guilt. And I think South Asian populations tend to have a greater amount of shame. I would just illustrate it with, let's say, a Japanese. The way I have thought about it is, let's say the Japanese approach to harakiri, for instance, is that they are so ashamed, they have to do it.
Right.
It's a sort of inculcated into them. I don't think it goes to that extent in India or in the South Asian population, but there's certainly a trend in that direction. You hear about rape and revenge killings, as well as suicides in certain communities. All of these speak to shame, and that's my point.
I'd just like to make a point about this. So, again, adding to the concepts of guilt and shame that you mentioned, I think this is where in society we probably would like to see a change, is that when rape occurs, rather than the perpetrator feeling guilt for his actions, the victim is made to feel shame for being a victim, and there is a resultant burden of either disassociating from their family so they don't bring humiliation to them. I think, and then a lot of times this results in then the victim taking their life, whereas they didn't do anything to bring them upon themselves. So I think this is where also this could be a starting point for change in those approaches and mindsets and conversations.
Yeah, there's a comment from Vasudev Makhija. He's the founder and director of Samhin, which is an organization that promotes mental health awareness in Asians and Indians. He says, I've questioned spiritual heads of institutions like a temple or an Islamic center about what would they recommend to a congregant who presents with thoughts of suicide. The answer I often get is that they would tell the congregant to pray harder, but there's no mention of a mental health referral.
Yeah.
What I've discovered that most South Asian spiritual heads are not required to obtain any pastoral counseling experience or pastoral counseling degree or certificate. So, I think this is something that we as professionals might have to reach out to spiritual leaders for collaborative conferences or collaborative dialogues, so that if people see a psychiatrist and a pastor or a psychiatrist and a priest talk to each other and try to address this together, it might actually have a greater impact,
One avenue to do it is almost all South Asian temples in our area that I know, Hindu temples, have a health fair. It is imperative for us to be present there. Health is not just diabetes measurements or hypertension.
Right.
I think it is mental health too. And having a presence there would be something that we all can dedicate ourselves to do in our own communities. So the bottom line is, yes, there is ignorance and there is not the right direction in which it's going, but there is an implied responsibility to help out and direct it in the right way.
I think also it ties to the notion that, as you said earlier, people still think that this is a sign of weakness. Thinking about suicide or thinking about trying to make an attempt is a sign of weakness. And somehow by either praying more or having more hobbies or having more, things, you will be able to completely eliminate this. And I think to a certain extent, it might make you resilient, but it is not going to be a full answer. There's a question from the audience. Rashmi Dadlani asks,
Yeah.
how is teenage suicide different from adult suicide?
Yeah. So, Ranga, do you want to answer that question?
The child psychiatrist gets precedence.
Okay, so I can add my 2 cents here first. So essentially, I think it's important to recognize first that, thank you for bringing that question up, because suicide is definitely very common in teenagers. It is often overlooked. A lot of people feel like children and teenagers have nothing to be depressed about, or they have nothing that could cause them to want to end their life. So first of all, it's important to be aware that it's actually a very, very common cause of death in that age group. Um, the second thing I think that is important to realize is, and then we can talk about this a little bit more later, is the types of suicide. So there is a pre-contemplated suicide where somebody has been thinking about it, planning about it for a while. They have taken into consideration a lot of things. And then there is also an impulsive suicide where one fine day you're okay, the next day you just impulsively decide to take your own life. So as we know, teenagers tend to be a lot more impulsive in general because their frontal lobes of their brain are not completely developed. Um, that development actually gets completed around the age of 25. So even young adults can be impulsive like teenagers. So it's really important to realize that teenagers anyway tend to be impulsive. They don't necessarily think about consequences of their actions as much as adults may. So it's very important to realize that there may be a lot of impulsive suicide in teenagers. So that is one big difference that comes to my mind. They may not really think things out. They may not really know how to put their words into emotions. They may not have talked about this to people. So they may not have reached out to anyone, and then suddenly one fine day, a lot of times there'll be subtle cues, but they will not really talk about their feelings because they have not developed that language yet. So it's important as a parent and as a family support and as a provider to be able to recognize those kind of hints in teenagers.
I want to add, sorry, go ahead.
But do you want to show that hint that you were telling us about yesterday?
Yeah, so essentially there was so a few years ago there was this graphic that somebody created, a tattoo, and the tattoo reads "I'm fine." So that's how it reads to other people. But if you invert it, it actually says "Save me." So the person who actually looks at the tattoo, let's say it's on their arm, can see that it says "Save me," but to everybody else it looks like "I'm fine." Let me just share my screen so you know what I'm talking about. Is it visible? Yeah.
Yeah.
So this is a good example of how people may really not be feeling fine, but they may project that they're fine. So this, sometimes teenagers will post graphics like this on their social media, or they'll post, different songs, or they'll post like dark pictures, or they'll start talking more about death. These are all subtle signs
So
that
can you rotate this image so that people can see what you were trying to refer to?
um hold on, let me try this. No, I don't think I hold on. I think I'll have to save this image and then rotate it. Yeah.
All right. So I guess people can just turn their devices and you'll see that
Yeah.
you'll be able to see what.
Yeah, I mean, if you just Google "I'm fine, save me," you should be able to find it.
I think I would like to add another point to that aspect of the difference between teenage suicide and adult suicide. So, in adults, depression can often present more in the form of melancholia or sadness, where they may be withdrawn, they may not reach out to people, and lay in bed and just be more down compared to their usual selves. Whereas a common presentation of distress or depression in teenagers is acting out or being more irritable, etc. And that is their language of communicating that they need help. But it's very hard to distinguish that from average teenage behavior. So the demarcation between what is normal and what is not is a little more nuanced in teenagers. So I think it requires a lot more sophistication to understand, who is this whether this person needs help or not. And I think that's through conversations and through discussions, perhaps parents can start to learn, what may be a more distress or an SOS signal in a teenager. And it may be a little more challenging to learn that compared to adults. So when someone does get to the precipice of suicide, I think it may come as a greater shock to people because they have not seen any of these signs leading up to it.
So talking about, just continuing the conversation about teenagers, maybe we should talk a little bit about how has social media made this a little bit more challenging or a little bit more complicated? How has it played into this whole dynamic that's prevalent in our society? Maybe Manan or Ranga, you can tell us about your views on how social media has made it, because that's a concern that many parents have.
Ranga, go ahead.
So there's a tremendous amount of peer pressure. If you think of a teenager's world is essentially parents and peers, because they are not yet in the workforce, and therefore it's very important for them to communicate with their peers. And one of the mechanisms through which the whole virtual sphere, the virtual world in which they live in, has replaced the intimacy of what used to be the kind of social interactions people of my generation had as a teenager. So I think that has a role to play. They express themselves in social media in subtle ways. Sometimes those are not understood by those who are not within their social circle. And this is one of the challenges for the parents and teachers to understand what exactly is being said and done there. And all of the things that would be settled in the school backyard is often settled on social media with tremendous deep emotional effect. Because if you think about it, I've had a scrap in the school backyard with a classmate of mine. It is over. Whereas if it is in the social media, it lives to haunt them for days. So they get re-traumatized. So
And it goes on. It goes on even so you could leave it in school and come home. Whereas with social media, it doesn't leave you. It's always there.
That's exactly what I was trying to say. Thank you. Yeah. So that's my first take on it.
Manan, you want to add something, or you have any other points to add?
Yeah, so yeah, I just think that like Ranga was saying, there are a lot of subtle ways, and there are a lot of these new platforms that keep on coming up, and adolescents will move on to different platforms. So it's really important for us to be aware of, what kind of platforms are there. It's important to also look into the technical aspects of these platforms a little bit to see what kind of, how do these platforms work. For example, when Snapchat first came, you could send these messages which would then uh, not exist, they would disappear. So um, teenagers would, people would in general feel more comfortable sharing things which were sometimes even inappropriate, or sharing things which they felt like there would be, there's no posterity with this, so they would be able to share more things. So I think it's important to learn about these differences of different platforms, and it's important to have an open conversation with your child that, look, a lot of these things happen on social media. I need to be monitoring your social media, and there has to be that trust, and there has to be that discussion openly in the household.
I mean, one positive thing that I find about this is that I find that actually grandparents are taking on to social media and interacting with their grandchildren through social media much more than the parents. Parents are busy making a living, with their jobs, but grandparents are actually getting involved, asking their grandchildren to teach them, and in doing so, somehow being able to connect to the grandchildren. Because especially if you're an immigrant family living away, it is much harder. And it is interesting to see how Instagram has connected grandparents and grandchildren, or the story on. But again, the other challenge on the grandparent side is that these media and these technical advances happen very fast, and it's really hard for them to keep up with it. And so there's a question from two of my friends from the UK, Subodh Dave and Ananda Dave, are asking, how much does the good immigrant narrative play into the increased suicidal risk for immigrants? And a follow-up question from Subodh is this hypothesis also applicable in India?
Yeah, the good immigrant puts a tremendous stress on the second generation. So so the person who has migrated often feels like they have provided so much for their kids, much more is expected of them than, and then they themselves, the immigrant themselves, suffer from, I have left everything, I've sacrificed everything, and I have come here, and therefore a greater expectation on themselves. Both of these lead to disappointment, and disappointment is the first step along that uh, channel, which could go to depression and potentially suicidal thinking.
So I would like to weave another current situation into this narrative as well. So racial prejudice. So I think a lot of immigrant families also feel that scholastic excellence or doing well in academics or in their careers is one way to overcome or uh, handle racial prejudice that immigrants would be subject to. And I think that also increases the pressure on the second generation children. That is, if you're doing well, then there will be a reason for you to, or there will be a way for you to overcome these kind of biases. So that's another way that there is pressure on these kids.
So
Yeah.
relating to the questioner, I would say the highly competitive society in India, where there are very few opportunities compared to the population base, also leads to the same kind of pressure that I sacrifice everything to give you a good education. I'm sending you to a private school. I'm paying extra for the tuition. And now you have to deliver with, topping the IAS exam or IIT entrance exam, or whatever the aspirations of the parent is. So
So I'm a little mindful of the clock. I feel we have about 15 minutes left for the hour. I would like to
Yeah.
try to spend the last maybe quarter of our time to talk about what are some things that we could do, what are some things that people could do to either improve their resilience, improve their awareness, improve their level of sophistication about this topic, and to not just treat this as an event in somebody's life, but as an ongoing process of educating ourselves. Like even I, Rachna and Manan have learned so much just in the last week preparing for this. So even after doing this work for 20 plus years, you still learn so much.
Right.
And so let's just spend a little time talking about how can one improve the maybe resilience of people in general so that they could be more prepared. I mean, especially like, situations like COVID can heighten social pressures, social financial pressures, employment pressures. What are some things that people could do?
Um, I actually learned from discussing with all of you about resilience. So I will now, I've come to realize that there is individual action that goes into resilience, taking better care of your health, being positive, diet, exercise, and so on. And also in your individual psychological thinking state, having a positive frame of mind. These are all things things that people can do on an individual level. Much more effective, I feel, is the social context. Friends and family joining groups are obviously helpful to feel integrated, and therefore that helps to a great extent with being resilient in the face of adversity. The other thought that has struck me is that when adverse circumstances come, most of us think that there is going to be a negative mental health outcome, but there is also personal growth and strength when people are committing themselves to change. And I think it's very important to stress that aspect of adversity and resilience also.
Manan, if you don't mind, just share the diagram that I
Yes.
had shared with you. This was a diagram actually created in response to the COVID crisis. And
So yeah, the self-care column is what I would like to direct everyone's attention to.
so let me explain the genesis of this column. So, I and a friend from Mumbai were talking about this, and we were trying to figure out all the psychological or psychiatric problems that people can have during COVID times. And in the first column, you will see the list of problems that people can come up with, which is practical problems, worry, depression, decreased adaptability, anger, addiction, isolation. And I wouldn't want you to focus on the second or the fourth column, but in the third column is a column where we listed a whole library of self-care resources that people already know about, like whether it's diet, exercise, sleep, connecting with others or nature, practicing mindfulness and meditation. There are lovely apps available out there, rational self-analysis and counseling, gratitude-based activities, like even just going to bed or waking up in the morning and asking yourself or telling yourself or making note of three things that you're thankful for has been known to reduce depressive symptoms by close to like 25%. Volunteering, self-compassion and self-soothing skills, giving yourself the permission to be, like lazy one day or to be not that productive one day. It's okay. Not everybody has to be at super high capacity every day. Even in art. Now, I have a slight comment there, which has been try not to just consume art. Like I've heard these comments on online where I've binged so much Netflix or Amazon Prime that I'm not even enjoying it anymore. Try to maybe even do something simple to create some art or to even write something or to draw something or to make some crafts with your children. Learn a new skill, a new language, a new recipe. And, I purposely put spirituality last because I feel that comes very naturally to people from South Asia and at the risk or at the cost of anything else. So this was just a simple diagram in my mind to tell people that there are so many things that we already know about. You already know about. You just have to activate some of these things that got ignored and that got kind of short shrift because of so much going on in the last 3 months, especially because of the COVID crisis. Anything you want to add, Rachna or Manan? Or
Yeah, so I wanted to talk about the term equanimity, which is accepting both good and bad times in a balanced way, in an equal way, and towards the conversation about developing resilience. I find myself having this kind of conversation with many of my older patients who I see in the hospital. They feel like now there is no purpose for them, that they've raised kids and they are, there is no reason for them to be around. There is no external motivation for them to be around. And then when this kind of adversity when this kind of feeling is complicated by adversity like COVID, then it gives them a further sense of being a burden, like their kids are bringing them groceries or taking care of them. And this then creates this sense of frustration and feelings of life would be better off without me. I wish I were dead. And I often tell them, you've been a good role model to your children to aspire to higher goals, etc. But one of the important roles you are fulfilling now is teaching your loved ones how to accept frailty or aging and loss with grace. So your kids are observing you, and this is also one of the things they are learning from you. And this is your purpose at this age. So trying to maintain a balance and creating resilience in that way is also important. So I think that's one of the things I would like to add to the to the conversation about how to create or improve resilience.
And Manan, I mean, I know you probably see kids at the earliest age. Like, what
Yeah.
are some things that parents can do, or grandparents can do to start inculcating lessons of resilience early in life, right from the time they're children?
Yeah, I think the most of the things that you have mentioned, many of these apply to kids also. For example, they parents will not realize what's the importance of having routines, what's the importance of a good sleep habit, because sleep habits form early, and if you're not paying attention to sleep habits, then you can quickly get into bad habits, which would really, as we all know, how poor sleep affects our mental and physical functioning so greatly. Another thing is social connections. I think, with social media, people feel like they are well connected, and it is certainly a very, it certainly has its positives of being able to connect with people, but also humans are creatures which, we need one-to-one interaction. We need to see people face to face. We need to be able to shake hands. We need to be able to hug. Um, so being able to foster these kind of close connections, not having like 500 Facebook friends, but not really having even one or two close friends to talk with. That's something that people oftentimes struggle with. So telling children to foster their relationships with friends, I think is a really important part in building resilience, because loneliness, social isolation, these are also huge drivers of many of these things that we see. So I think that's one of the things that's important, I feel.
I think across all age groups, helping people to move their friendships into confiding relationships is a major protective factor. And I think a lot of us rarely confide our own problems with friends who would be available for us and who would be understanding and who would be supportive. And that is a skill that one can develop and learn how to confide in people and derive support.
Yeah, I think I've learned this recently, that it's easy to portray an image of strength or of competence or of self-efficacy, but you draw more people, or you at least draw more emotional support if you share vulnerabilities, and if you share that you are imperfect in some way, and you don't have to always be the stoic state person who has no vulnerabilities. It's okay, everybody's human. We all mess up and screw up in different ways. But I think sharing, what I found is, like, the deepest conversations I have, or the most meaningful conversations I have with friends, even if with Rachna or Manan or Ranga, is when I'm able to tell them how I'm struggling at something, or how I'm having a hard time with something. I mean,
Right.
I can have endless conversations about all the good and great things that I've seen and done and accomplished. But I think that doesn't lead to, it makes me feel good, but it really doesn't lead to meaningful or more deeper conversations. It's only when I've discussed my sensitive emotionally painful or emotionally challenging things. That's when I find that our conversations not only are meaningful, but also memorable.
I want to stress that point by contrasting it with the lives that people lead on Facebook. It is really this extremely successful, happy, they're always traveling. Well, not anymore. So the point is, this is exactly what a true social interaction
Right.
allows for, that the virtual interaction deters them from doing it, because you can't just post, oh, I'm having an awful time on Facebook, and just expect everyone to read it and
Yeah,
react.
there is always this phenomenon of fear of missing out. And, I always tell, people that you're comparing your inner life to somebody's outer life. Facebook is somebody's outer life, what they choose to show you.
Yeah.
You're not really seeing what their inner life is. I mean, we know plenty of friends and family members who have the most perfect, lovely pictures on Facebook. But in talking to them, we know that their lives are equally, bumpy, like many other lives that we have seen.
Right.
So I'm just going to wrap up a little bit, just with a few things. One is, I've learned many new things can be done on social media. I've heard about people having Zoom antakshris. I've seen about people, having watch parties. I've
Right.
seen about people teaching each other how to cook. I've seen people doing collaborative art projects or collaborative even music jamming sessions. So this is making us grow and develop in ways that we have otherwise would have not discovered, and discovered so fast. I'm sure eventually it would have happened, but it wouldn't have happened this fast. So I think we can also think of, just like you said, Ranga, we can think of this challenge as a way to teach us some new things. And this lockdown or this shelter in place is certainly teaching us these new things. I would also like maybe Manan and Rachna to share some professional uh, helplines or numbers that if people need help, they can always call. I mean, I mentioned Samhin. Samhin has some helpful numbers there. Deepika Padukone's foundation, Live, Love, Laugh, Love
Right.
Foundation, it
It's
has a
live,
lot of
la.
helpful
Yeah.
numbers in India. And Manan, maybe you can also share. There's one from the American Foundation of Suicide Prevention that you can always reach out to. And
Yeah.
again, always sure talk to your primary care doctor, your own doctors. They might know how to get you help.
Yeah, I don't have the slide over here, but I'm definitely going to post these numbers below the video on the post. And there's a national suicide hotline number here in the US, and there's also a text line which is 741741. It applies only to people here in the US, but you can text help or you can text anything to 741741 any time of the day, 24/7. Um, and the National Suicide Hotline is 1-800-273 HELP, right? And
So
then and
yeah,
we have some resources for people in India also, which I'm going to post after this video.
so maybe we'll take one last round of, just if you had like to say one or two things to all the listeners, what would your take home or takeaway points be? Maybe we can start with Ranga.
Well, I would add to what he was saying that shortly 988 is going to be the national uh, helpline. It is coming in the United States. Uh, that is the first thought that I have. So I'm going to let other people say whatever they.
Rachna?
Yeah.
So I think the term I would like to leave you all with is something called social responsibility. And what I would say is adopt 7 or 8 of your friends as your group of people to check in on regularly. And that is each of our social responsibility. If you make sure uh, you are hearing from them, you are reaching out to them every so often as your schedule permits. And if if you see any change, if you see any concern, reach out. Don't be quiet and check in with people. You may be surprised at things that may come out of doing these things, and it will also enrich your own life. I've started doing it in my sphere of friends, and I think if each of us does this, we will be a much better connected society, and hopefully that will be one way to reduce the incidence of suicide. So please do it now. Pick up your phone, call your loved ones, check on them.
Manan?
Right. Yeah. So I would essentially want to piggyback on that and say that, just like what we're doing right now, talk, keep talking about these issues. Don't shy away from asking questions. Talk about your own issues with your loved ones and with people that you trust. Um, Sometimes if you talk about your issues, people will feel more comfortable talking about their own issues. So definitely keep the conversation going. This is one thing that, like Rachna said, this is our social responsibility. Um, we should not ignore, we should stop sweeping these issues under the rug, and we should talk about these issues openly as much as possible.
And my last point is, this whole series was called Samarpan, which means dedication, and we wanted to dedicate these series of conversations to South Asians, mental health of South Asians. So, one thing that I, Rachna, and Manan have decided to do is bring you more regular features or messages or even such conversations on Facebook and maybe other platforms over time, to not make this a one-time event but an ongoing process, so that my goal at the end of this would be that we would be as psychologically minded or sophisticated in talking about these difficult issues as any. We certainly have a very rich, varied history and a lot of diversity and a lot of strengths that come into play culturally and from a point of view of art. And we could certainly merge all those strengths into these conversations and bring more of these to you. So please join us and invite your friends and family. And thank you all.
I commend you all three for taking up this initiative. And I thank you for allowing me to be a small part of it. And I look forward to the future programs, because I think this is a great initiative. Thank you so much.
We'll call you again. You're not going anywhere. Thank you, Manan. Thank you, Rasna.
Thank you. Thank you, everyone, for tuning in.
Bye.
Really, thanks.